Good morning, Miss Wagner. Before we get you all packed up to leave, we're going to go over your discharge instructions. And if you have any questions while I'm going over them, you can just stop and ask me. So for your pericare, we just want to make sure you keep your bottom very clean. And as always, we want to wipe front to back. And I'm going to give you a squirt bottle. Just fill it with warm water and spray it over the area as you're using the bathroom and after. And you can just take your tissue and blot it dry. We don't want to rub it because it's going to be very sensitive down there. So, and then as far as your bleeding goes, for the first couple days, it'll be probably dark red. And it'll continue to lessen as we go through day 10. And if you see any heavy clots or increased bleeding after day 10, you're going to want to call the doctor. For your breast care, anytime you touch your breast, to clean them, we want to make sure we wash our hands before breastfeeding because baby's mouth is going there. We want to make sure that we lessen the spread of germs that baby is receiving. Your best option is probably going to be a good support bra without underwire, because our underwire can cause clogged ducts, and we want to keep those flowing. If you get engorged or your milk supply is not letting down, you can take a warm shower, and that'll help your milk to release. And then after feedings, if you're sore, you can do a cool compress. If you have any leaking during the day when you're not feeding, you can use some breast pads to just slip in your bra. And then if your nipples become cracked from breastfeeding, then you can just express some breast milk and rub it on the outside and let it air dry, or they also make some breast creams. Now, when you're breastfeeding, we want to be aware of our medications. Any medications that you take will come through your breast milk to baby, so we want to call the doctor for any medications before you take them. And then for pain, you can always take Tylenol or ibuprofen short term for any of that pain and discomfort you're feeling after delivery. So because you had gone into labor and then ultimately had a C-section, you have your episiotomy stitches and your C-section stitches. We just want to make sure that those areas are clean and dry at all times, and that you monitor for signs of infection daily. So there's no redness or warmth to the incision site. There's no drainage or pus coming out. There's no excessive bleeding. And if the wound were to separate or a stitch were to come out, that you would just give the doctor a call so that you can be seen quickly for that. As far as your activity, we don't want you going up any stairs for the first couple of days. We want to minimize any pressure put on the pelvic region or the incision. So for the first couple of weeks, we don't want you to use the stairs. After that, you can use the stairs once a day and then gradually build as you get closer to 4 to 6 weeks. As your hormones change after birth, they're going to go back to normal, and you're going to want to watch for signs of postpartum depression. If there's any loss in interest from the baby cues, from crying or wanting to be fed, if you have a loss of interest in baby, if you have a loss of pleasure in things that you normally would find joy in, if you have a lack of appetite or crying excessively, all those are signs of postpartum depression, and you would want to call your doctor to speak with him about those. And the most important one is if you have any thoughts of harm to yourself or to baby, we want to call the doctor just so he can get you some additional help in that area. we don't want you driving for 2 weeks after your C-section. Any twists or turns while you're driving may put pressure on your incision site. And the major things that you want to consider calling the doctor for, or if they happen to make sure you return to the doctor for a follow-up, would be increase in pain, excessive bleeding or large clots past your 10 days, signs of infection, so our fever, drainage at your incision sites, redness, or swelling. Okay, so that's all for you, and now we'll talk a little bit about baby. So baby, we want her to breastfeed for 8 to 12 times in the first 24 hours, and we want her to use both sides, each feeding and breastfeed if she can until the breast is soft, to make sure we empty all of the milk out of the breast, and then just feed on demand as needed. And the way we measure how much she's getting is we monitor her output. So as long as she is having 6 to 8 wet diapers in 24 hours, and then 3 to 4 stools in 24 hours, then we know that she is adequately fed. And you can keep a log of the breastfeeding and the diapers in a little notebook, and that'll help you to remember, because as you get tired and these feedings kind of run together, it's easy to lose track. So we want to keep track of all those, so when we go to the doctor, we can properly give him the information. The umbilical cord, we're going to remove that clamp before she leaves, and we want it to stay dry and clean. No soap or anything on it. You can, if it looks dirty, you can clean it with a moist cotton tip and just rub around the outside. And we want to monitor for any redness or swelling. And the most important piece about the umbilical cord is we don't want any full immersion in bath or underwater for that umbilical cord until it falls off. And speaking of bathing, we are okay with sponge baths. We want to make sure baby's temperature is where it needs to be, and the bath water's not too hot. Those are our main topics for bath. And again, no submersion unless the umbilical cord has fallen off. So with a newborn, she does not have the fat she needs to regulate her temperature. So we want to make sure that she stays nice and warm, anywhere from 97.7 to 98.6. And want to just always monitor that her lips are not blue. And anytime if you feel her heart rate increase, or you can just feel that as you're holding her, then you want to make sure that she's warm. You can test her temperature under the arm, as we have in the hospital, and make sure the arm is close to the body while it's monitoring for the temperature. And then also we want to check her skin. Anytime you notice a yellowing of her skin or the sclera, the whiteness of her eyes, then you want to give doctor a call. And then as far as sleeping goes, we want to always have her on the back to sleep. And we would prefer her to be in the room with you for the first little while, and no blankets or pillows or stuffed animals in the bed or bassinet. And we would encourage her to be in her own space to sleep, not in bed, just to make sure that nobody rolls over on her or she gets suffocated with pillows or blankets. She doesn't have a great immune system at first, and so we need to be her first protection for that. So we always want to wash our hands before we touch her, and any visitors that come, we also want to ask them to wash their hands, and especially after changing diapers, make sure you wash your hands. All the signs and symptoms of infection that you would want to call doctor for would be a temperature above 100.4. If she loses interest in feeding or is not feeding well, if she has vomiting or diarrhea, our number of wet diapers is decreased, any of those things. Also, you would want to call doctor if the baby is having blue lips or flared nostrils. That would indicate difficulty breathing, or if she is crying inconsolably. Our car seat safety, she passed our car seat safety check. We want to make sure when you go home that it's rear facing and in the back seat, preferably in the middle seat, but rear facing in the back seat until age 2 or until she exceeds height or weight. And her first wellness check will be in 2 to 3 days with the doctor, and they'll set that appointment up with you before you leave. And then you'll go monthly for 2 months, and then it'll go to 2 months and extend on for the first year. And that'll just be to check for developments and vaccinations if you choose to have them. So do you have any questions for any of these instructions?
No.
Okay. So I'll send you home with all this. I know that was a lot of information. I'll send you home with a printout, and you can call the doctor for any additional care that you might need, and the pediatrician for any additional care that the newborn would need. All right, thank you.
Thank you.